Welcome back to Breathing for Better Sleep with Dr. Eck, the show that explores natural root cause solutions for snoring, sleep apnea, and childhood sleep challenges without CPAP or surgery. Today's topic hits close to home for so many parents: ADHD symptoms that might actually be airway problems. We're diving into how something as simple as how your child breathes can change their focus, mood, and even their long-term development. Dr. Eck, how are you doing?
I am fantastic. How are you?
I'm excited. I'm excited to dive deep into this topic because it certainly hits home for me. I don't have kids, but I can relate to a lot of what we're speaking about today in my own personal experience. So, you've said before that a lot of kids are being treated for the symptoms of ADHD instead of the cause. When did you first start noticing that pattern in your own patients, and what made you dig deeper?
Oh, as far as the ADHD in kids, it actually, funny enough, started with my own son. We were contacted, me and my wife were contacted by the school. He was probably around 10 years old. And they had suggested that we take him for an evaluation for ADHD. And ADHD, by the way, is the most commonly diagnosed mental disorder in children in the entire U.S. And I look back at my friends who have children on medication and diagnosed with ADHD, and I used to always tell them, what get to the cause. What's causing this? Why are we medicating this child? Whatever. And then boom, all of a sudden it comes and they say, oh, my child could have this, right? So then I had to start doing a lot of research and figuring stuff out. And I talked to a psychiatrist. I talked to a behavioral psychologist, and they said the first thing you need to look at is, sleep patterns, etc. And they explained the importance of REM sleep in children. And keep in mind, I treat sleep. I treat growth and development and problems in kids. And I said, oh, okay, so I have my child at 10 years old do a sleep test. His REM sleep came back almost zero. So this is the analogy that I tell parents. If you have a child who's 4 years old, who's used to getting a nap every day, and they don't get their nap, how do they act all afternoon? Right? Not good. If they're acting like that all day, starting in the morning, right, even after sleeping all night, it's like they didn't get their nap. So what that means is they're sleeping, but they're not getting into the proper stages of sleep. They're not getting into REM sleep. And if they're not getting into REM sleep, they can sleep 10 hours and they're still going to act like that. And sure enough, my son had no other signs of having a sleep issue other than this. And so I get a sleep test done, and his REM sleep is almost zero.
So, and you mentioned before that your father had sleep apnea, right?
Yes.
And can it be genetic or not at all?
I mean, there is a slight genetic component, to most things, including sleep, but for the most part, no. Because when you look at how your airway develops, your jaw develops, your bite is not genetic. After 18 months, your bite is no longer genetic. Your orthodontics is no longer genetic. It's environment and habit. And so within the same family, obviously, there can be the same habits. There can be the same environment. There can be the same diet. And these are the things that contribute.
And by the time you diagnosed your kid, you were already treating sleep, right?
Yes. And we were doing orthodontics and palatal expansion and all this stuff, to make room for permanent teeth and everything else. And so for him, we just put him through our normal phase 1 orthodontics. We palatal expansion, widen the arches, make more room for the tongue. When you do the expansion, you also widen the nasal passages. So we just did a normal phase 1 airway treatment like we normally would. And, you know, a lot of people do this for obviously orthodontic/cosmetic reasons. For him, it was done for function. It was done for airway.
And there's a visible correction in its facial development, jaw, teeth.
Oh, absolutely. Because once we accomplish this, because he had some severe crowding, no room for his permanent canines to come down. And once you help improve the airway and the nasal breathing, well, now the jaws start growing again. And if the jaws start growing like normal, and now we make room for the teeth to come in. So it essentially made his need for orthodontics as a teenager more a very minor case that was really about a little bit of cosmetics and not this big drawn out orthodontic process that it would have been if his jaws did not continue to grow. And they weren't growing because of his abnormal breathing.
And regular orthodontics won't help with airway?
Orthodontics, traditional orthodontics done in the hands of a person who understands airway can do it in a way that it can improve at certain ages. It can improve. Orthodontics in general for an adult, no. As a child, it can improve some, more than it can in an adult, the airway. But it's got to be done by somebody who understands airway, which 98% of orthodontists do not. So it has to be done by an airway-driven or airway-centric office, whether it be their general dentist or pediatric dentist or their orthodontist, somebody who understands airway, so that it drives it that way.
Okay, I see. If you were to put two kids side by side, one with actual ADHD and the other one with airway, compromised airway, what would you see different in each kid?
Well, if it's truly behavioral, and that's what it is, then you're not going to see physical signs, right? If it's airway driven, you're going to see physical signs. You're going to see altered growth patterns. You're going to see asymmetries. You're going to see the jaws not growing, orthodontic problems, crowded teeth. You're going to see when they just sit there in front of you, their mouth is open. If your child's like this, that's abnormal. Having your mouth open at any age is abnormal. Your mouth should be closed. So you can look at them, their mouth breathing, any of those signs that we spoke about before that are signs of airway issues. You're going to see that in those kids that have ADHD that is related to their airway, which is, from the best I can see right now, is about 70% of kids diagnosed with ADHD don't have it. They have an airway problem, and you resolve the airway problem, and all of a sudden, all of that goes away.
This is really interesting. I think that we don't often look at kids' physiognomy and actually look at those areas of the body of the face that you mentioned that could be related to compromised airway. So that's a good clue for our listeners to note. And I've heard you say before you can't medicate oxygen. That's a bold statement. What do you mean by that?
It's pretty simple. There are no substitutions for oxygen, right? We can live a long time without water. We can live a long time without food. We cannot live a long time without oxygen, and there is nothing you can put in place of it to replace it. So we have to breathe. We have to produce oxygen, and so even when you take somebody who has, say, emphysema or COPD or some of these disorders that are not related to disturbed airway, okay, they're lung disorders. You can put nasal cannulas and oxygen to help them get along. But when you're talking about a true breathing disorder where we're not producing oxygen, sleep apnea, for instance, or upper airway resistance, if you put somebody on a nasal cannula, normal oxygen with a little nasal cannula, that does not overcome the breathing disorder. So you can't just substitute it outside of a forced air CPAP mask. but normal nasal cannula oxygen does not cut it.
Okay, so that's an important point you mentioned there, because people can have a lung disorder and therefore they're not breathing properly or they're not getting enough oxygen, but it's not a blockage situation. Whereas to the sleep disorders we're speaking of, it's more of a blockage of the airway. It doesn't have to do with the production.
Well, so when we're talking about sleep, disturbed, breathing or upper airway resistance or sleep apnea, there are restrictions in the airway somewhere and blockages. Going back to the analogy that we used before with the kink in the hose, right? There's a kink somewhere stopping the oxygen, stopping us from breathing. Stopping us from breathing then just stops the oxygen production. And if you look at, for instance, pulmonologists treat lots of airway lung problems, right? If you go into a normal pulmonology office, sleep apnea and sleep disorders is 15 or 20% of their practice. 80% of their practice is treating these other things, lung problems, COPD, emphysema, etc., right? So it's only a small percentage of their practice, these sleep disordered breathing, as opposed to these other things. So sleep disordered breathing is just something completely different.
Okay, I guess that was my question, whether emphysema or other lung problems were related to sleep disorders or sleep apnea, but they're different things, but pulmonologists are supposed to be treating both.
All of them, yeah.
All of them. Okay. You've said before that tired kids don't get sleepy, they get wired. What's actually happening in the brain when that occurs?
So, and you go back to the example I gave you about the 4-year-old that doesn't get their nap, right? And now how they act all afternoon. Now they're all wound up. They don't behave well, right? And the fact that they didn't get their nap, you might think they should be tired. They might just want to lay down, but they don't, right? They act the other way. And they have a problem focusing, aggressive behavior. They're cranky. These are all common signs with people who do not get their proper sleep or they get fragmented sleep. And these are the same signs, by the way, that we have in children with ADHD. Right? So it's all related. It all has to do with what we call fragmented sleep. You're not going through your 4 stages of your sleep cycle. You're getting pulled out of certain stages, whether it's the deep sleep or the REM sleep. You're not getting or staying in your proper stages of sleep as you should.
But you could get both situations where there are kids that are wired and there are the kids that would be falling asleep in class per se.
Oh yeah, it can be either one. That fragmented sleep can lead to that hyperactivity, and it's the main cause. Fragmented sleep is the main cause of neurobehavioral effects associated with this sleep disordered breathing, right? And some kids just get tired. They're tired all the time. They just sit there and yawn all day, right? But then this other issue can happen as well. Sleep disordered breathing can be the root cause of a patient's emotional or psychological problems, right? Hypoxia, which means your oxygen is going down, impairs brain function. Chronic oxygen deprivation leads to damage to brain cells. And these cognitive deficits can be permanent. And some of these cognitive deficits may not show up until much later in life. We see patients that come in, they bring this 5, 6, 7-year-old, and they're brilliant little kids. And they end up having moderate or severe sleep apnea. And you just got to get that point across to the parent that this child at 7 is brilliant and seems to be beyond their years and being smart, right? But these oxygen deprivations are going to create cognitive deficits. And a lot of times these cognitive deficits do not show up for years. Okay. And when they start to show up is when they get into a little bit higher education, they start taking harder classes. And then that's when the learning disabilities start to show up.
Yeah, I guess it really impairs your ability to focus, right? And what about the parents who've been told it's behavioral or they'll grow out of it? What do you want them to know instead?
There are such long-term consequences of not pursuing a child's breathing disorder. And with all, as I just mentioned, all these neurobehavioral effects, how they're going to act as a young adult or an adult. Okay. You can literally curb or alter the entire life of this child as they get older if they have a breathing disorder now. So they should pursue an evaluation. See a dentist or see an ENT that is airway focused. And if they have any of this stuff, if you just think it's behavioral, it's real easy to rule out airway. Just have an evaluation. Are there restrictions or blockages in the airway? If there are, the chances are this is not just behavioral and they are not going to grow out of it. So just get that simple evaluation done, because if it is not just behavioral, then you need to treat the airway, or these problems are going to progress. They're going to last through adulthood and just create all kinds of psychological and emotional problems.
Yeah, I can imagine that it triggers anxiety a lot as well because you're breathing to your mouth, through your mouth, and you're breathing shorter or taking smaller breaths than you should be, and that can spark anxiety. Is that correct?
Anxiety is a very, very common side effect of breathing disorders. Anxiety, depression, all that.
Okay, we'll remind our listeners before we end the episode, but I know that you have a questionnaire in your website that we'll link in the notes of this episode so that if any parent listening to this episode feels related to the information we're giving, then they can definitely answer the questionnaire.
Yeah, it's a pediatric survey questionnaire, and all it is a list of questions. And there's just simple yes or no's. And then if they fill that out, then it will go to our email, and then we'll set up a quick 15-minute phone conversation to review it and what it can mean, or the likelihood that your child could have an airway issue based on the number of yeses that you have, or in which yeses that you have, because some of those questions weigh more than others. But they can also go to the website at sleeptreatmentdirect.com, the pediatric page on there, or they can go right into the show notes and fill that out. Either way, it'll go to the same spot.
Awesome, Dr. Egg. Thank you for that. And I know we've talked a lot about the physical effects of sleep disorder or airway issues, but I know that this can be very surprising for parents. So I just want to emphasize a little bit how that happens and what they can look for. Is it mild? How can they detect that right as it starts to happen?
I mean, one of the problems is we have seemed to normalize somehow breathing problems. Like a breathing problem is abnormal. And somehow we have made it seem like a breathing problem is normal. If we snore, we have a breathing problem. We have a restriction in our airway. That's why we snore. So if a child is snoring, that is a common sign they have an airway problem developing, right? If you look at your child and if their mouth is open like that, at any time that they're not, if you're outside of chewing food or yawning or speaking, your mouth should be closed. So if your child's mouth is open and or you can visibly detect their mouth breathing, okay, dark circles under the eyes, bedwetting beyond when they're supposed to, snoring, chronic ear issues. If your child has chronic ear issues, especially if a child needs tubes put in their ears, they most likely have an airway issue. They're related. Crooked teeth, underdeveloped jaws. These are just simple things people can look at and say, okay, we may have an issue here.
And the underdeveloped jaw, for example, is it very noticeable, or how can parents tell? Because I'm sure we also normalize those physical traits.
Well, I mean,
So
it could be very mild to the point you have mild crowding of your teeth. For some people, it's their jaws don't align up, right? The upper jaw or the lower jaw is one's longer or shorter than the other. When you see the person that has the no chin, right? The chin's way back here and the mouth kind of dripped open and it looks like they don't have a chin. That's a very common sign of a problem. Some people who have the vaulted or narrow palate, right? And that narrow upper arch. I mean, and they can be to different degrees of severity. Some are very, unless you're a professional, you may not notice it. Obviously, if they become more moderate to severe, then it's visible to the normal person.
and an off bite, would that be a symptom to look out for as well? Or that's a
Always.
different?
Yes, if you need orthodontics at a young age, keep in mind, we always talk on this podcast about root cause, right? Everything has a root cause. Orthodontics, the need for orthodontics has a root cause. And almost always the need for orthodontics root cause is an airway problem. That's what's causing our jaws not to develop. And if our jaws do not develop, we don't have room for our permanent teeth. So we have crowding, we have crooked teeth, we have bites that don't line up, jaws that don't line up. Those are almost always signs of airway problems.
And how early can you detect this? What's the earliest?
I mean, for some patients, you can detect this as an infant. I mean, there are signs as an infant. Again, go back to mouth breathing. If you see a 9-month-old sitting in a crib with their mouth open, sleeping, they have an airway problem at 9 months old. Okay. Another common sign is a child who's having a problem breastfeeding. They have a myofunctional problem, a tongue tie, a lip tie, something that makes it hard for them to latch on, and breastfeeding is difficult. That's a child who's going to have a myofunctional and airway problem. Young children, especially before the age of like 10, they can develop improper tongue posture, which can also sometimes be related to the tongue tie and such. Speech problems, jaw development and orthodontic issues, as we mentioned, chronic ear problems, as we mentioned. These are all signs at any age that you're developing an airway problem.
Wow, that really hits home. I have a brother that snores a lot, and I just thought that maybe he has sleep apnea right now because as an adult he snores, but he's been snoring for a long time. And now that you've mentioned all of these different behavioral traits that kids who have compromised airways have, and you just mentioned something right before I started speaking that really hit home as well.
Well, you had mentioned before when we were talking about your brother that even at a young age, between seizures, night terrors, all of these things that you had mentioned to me before, snoring at that age, okay? These are all things that are signs of a sleep disorder. So your brother has had this going on for a long time, including as a child. Now, he's an adult that has most likely sleep apnea, right? The problem is 80% of people in this country with a sleep disorder are going undiagnosed and untreated. And your brother is one of those people. Based on everything you've told me about your brother now and your brother as a child, he has a sleep disorder. And he fits that 80% number of he's not had a sleep test, he's not had a diagnosis, and is going untreated, as 80% of people do who have a sleep disorder, because we have just somehow, some way normalized abnormal breathing.
And I just remembered what I wanted to say that you just mentioned that I hadn't heard before when speaking with you. Speech development. You mentioned that. And
Yes.
and that's something that I would have never related to a sleep disorder. And that's one of the other things that my brother had when he was a kid. And we never could have pointed to the fact that it could be related to a sleep disorder or an airway disorder or anything like that. I think that they did studies for to see if he was on this autism spectrum, but never thought about testing for sleep. So I think that's a very important point right there.
Yeah. So that's with the speech. A lot of times that's coming from what we call the myofunctional problems. We have a reverse swallow. We have a tongue tie. We have a mouth breathing habit where our tongue is not resting in our palate where it's supposed to be. And these things can contribute tremendously to speech problems. So any child undergoing speech therapy should have an airway and myofunctional / tongue tie evaluation because they're oftentimes side by side.
And that makes a lot of sense because we're bilingual. We grew up speaking English and Spanish, both at home. And when he couldn't speak either language, we thought that it might be a cognitive problem. And because our mother tongue is also Spanish, we know how to roll the R, right? And everyone in my family could do it except my brother. So I understand that people that speak other languages is hard for them because they're not accustomed to it. But someone that grew up with Spanish as their mother tongue should be able to roll their R's. So
Right.
if he couldn't do that, it was probably what you mentioned, right? Like a tongue tie or
Right. There's a
something.
myofunctional problem there somewhere, which is consistent with everything else that he had.
That's very interesting. Very, very interesting, Dr. Eck. What's one simple thing that you would tell a parent to observe tonight after listening to this episode? What can he observe in his kid tonight that might reveal any of the things that we have spoken about today?
I mean, to me, there's just certain things you can look for that go back to the things we talked about. If you want to take a look at your child and kind of look at one or two things that are just very common. And unfortunately, they're so common that we don't find them abnormal. And that is mouth breathing. When your child goes to bed, give it a half hour, walk in and look. Is your child's lips closed, lips sealed, or is the mouth open partially? If it's open, that's abnormal breathing. You also want to check that 2 to 3 hours into sleep as well, because they might start with nasal breathing, but then convert to the mouth breathing. So check it shortly after falling asleep and check it 2 or 3 hours later. I would say that, and are they snoring or grinding their teeth? These are all things that are simple, easy things to look for that we've normalized, but they're not normal.
And I would say not to wait, right? No matter how old your kid is, these are things that you can look out for tonight.
The earlier you can detect this stuff and stop it, the easier it is, first of all, to treat, the earlier you catch it. And then the cognitive deficits and the other stuff that's happening because of the oxygen deprivations, many of these things are not reversible, and we don't detect them or see them, and they don't become apparent until later in life. So if there's oxygen deprivation, you got to stop that as fast as possible.
Yes. Please don't wait until the problem has evolved to the point that it's causing your kid problems. And when you fix the airway, what kinds of transformations have you seen in the kids?
So I had sent you a video to add to the link of the show, the notes of the show, and it's called Finding Connor Deegan. And I just love this video. My buddy put this together, and it just shows you what can happen. Okay. You can have it can be such a transformative thing That child that is quote unquote difficult from birth, behavioral issues, unhappy, poor grades. Teachers are saying there's something wrong with your child, inability to conform or fit in. When you're trying to figure out what's wrong with your child, and then you do, and you realize this is it, and you treat them, now all of a sudden, it's just transformative. Now you have this vibrant, loving, happy child who becomes this whole new person. And it's just the transformations that can happen with these kids is absolutely incredible. And I would encourage everybody to either go to our website at sleeptreatmentdirect.com or go to the show notes and click on that video for Finding Connor Deegan, and you can see what it can do.
Yeah, I had the opportunity to watch the video, and it's very powerful. You can give a kid the chance to live a peaceful life, because kids can really suffer it. And I know they don't have, they're not aware of how it is affecting them. So they can't really express that they're suffering, but through all those behavioral issues, through not being able to concentrate at school, through not being able to even relate to other kids, they are uncomfortable, they're suffering, and so are the parents. So yes, I would also highly suggest you guys take a look at that video, because it is very powerful. And having said all this, Dr. Eck, if the entire pediatric healthcare system started screening for airways issues tomorrow, what do you think would change in children's health 10 years from now?
The whole generation would be unrecognizable. It's the changes that it would make would be absolutely amazing. I mean, think about the little stuff, like what percentage of people needed, for instance, orthodontics 50 years ago? 15 to 20%. Today, 70% of kids need orthodontics. If you'd go back to paying attention to airway and breathing and get their jaws to grow normal, you'd get back to what it used to be. 20% of kids would need orthodontics, not 70%. Look at your brother as an example. His life as an adult, how different times and certain times would be, because all of those things, between the anxiety stuff and everything else, that has its root cause in childhood airway problems. So you're just taking and preventing so many of our health issues, between mental and psychiatric issues, blood sugar. I mean, when you look at pediatric and young adult diabetes and the rate at which it's going up, and the number one cause of diabetes and blood pressure issues is an airway problem. Sleep apnea is the number one cause. So if you take these things that we're treating now at record numbers and beyond what we've ever done in the past, and the most common cause of some of these things is sleep apnea. So if you treat the airway problem early, all of these medical conditions that we're treating and all the medications that people are taking, you just save that whole process. You just eliminate that whole adult, extensive medical history in so many people.
And even like you mentioned, there are all these imbalances that are happening at such a young age, like hormonal imbalances that kids are experiencing, that I'm sure they weren't normal in the past. And it's increasing. And with this conversation now, I think about how much of it is actually a result of a sleep disorder, of an airway problem. So thank you so much for this valuable information, Dr. Eck. I'm sure going to be very reflective on it, and I'm going to pass on this information and share this episode, because I think that there's so much that we can do for kids early on. and prevent further disease from developing. And overall, just creating a better life for everybody if we treat this, if we take this seriously, if we focus on sleeping well and getting treated when we need it.
It's the ultimate in preventative medicine.
That is so true. I for sure agree with that. Well, thank you so much for everything that you've shared today, Dr. Eck. Is there anything else that you would like to leave the audience with?
I think we're good. Thanks for having me.
Thank you so much. And that is it for this episode of Breathing for Better Sleep. If you're a parent who's ever wondered if your child's focus, anxiety, or sleep struggles might be more than just behavior, this might be your wake-up call. Share this episode with another parent or teacher and visit sleeptreatmentdirect.com to learn more about working with Dr. Eck. Because better breathing doesn't just mean better sleep. It means a better life. Thank you everyone for listening, and feel free to go and answer the questionnaire in the link in the notes or at sleeptreatmentdirect.com.
Thank you.